Hi everyone, welcome to Easy Nurse Education YouTube channel. Today, we'll be learning about diabetes mellitus, one of the most common chronic conditions worldwide. By the end of this video, you'll be able to understand what diabetes mellitus is, its types, risk factors and causes, signs and symptoms, diagnosis, treatment methods, and nursing care plan. First, let's understand what diabetes mellitus is. It is a long-term condition where the body cannot properly control blood sugar. This happens because of problems with insulin. Either the body doesn't make enough insulin, or it cannot use it well, or both. Since insulin is made in the pancreas, which is an endocrine gland, diabetes is also called an endocrine disorder. In short, inside the pancreas, there are beta cells that secrete insulin, which helps control blood sugar.
There are three types of diabetic mellitus. 1. Type 1 diabetic mellitus. 2. Type 2 diabetic mellitus. 3. Gestational diabetic mellitus.
What is type 1 diabetic mellitus? Known as insulin-dependent diabetic mellitus, more common in children and adolescents than adults. The pancreas cannot produce enough insulin or no insulin. What is type 2 diabetic mellitus? Most common type, chronic condition. Body can make insulin but either doesn't use it effectively, insulin resistance, or can't make enough to keep blood sugar in a normal range. Gestational diabetic mellitus occurs during pregnancy, usually disappears after birth, increases risk of type 2 diabetic mellitus later. Risk factors and causes of type 1 diabetes. The main cause is autoimmune destruction of pancreatic beta cells. These cells normally make insulin, which helps your body use sugar for energy. Without insulin, blood sugar rises. The risk factors include genetics, family history increases risk, autoimmune diseases, like thyroid disorders or celiac disease, viral infections, certain viruses may trigger beta cell attack, environmental triggers, early childhood diet or toxins. Risk factors and causes of type 2 diabetes mellitus. Causes. Type 2 diabetes mellitus is caused by a combination of insulin resistance and relative insulin deficiency. Risk factors. There are two types. 1. Modifiable. 2. Non-modifiable. Modifiable factors are those we can change, such as obesity, a sedentary lifestyle, unhealthy diet, smoking, alcohol consumption, high blood pressure, and high cholesterol. By improving these, we can significantly reduce the risk of developing diabetes. Non-modifiable factors are those we cannot change. These include age over 40, family history of diabetes, certain ethnicities like Asian, Hispanic, or African descent, a history of gestational diabetes, and conditions like polycystic ovarian syndrome. Sign and symptoms: increased thirst, polydipsia, frequent urination, polyuria, extreme hunger, polyphagia, weight loss, especially in type 1, blurred vision. Fatigue, slow wound healing. Diagnosis, usually done through blood test. Fasting blood sugar, its short form, FBS. HbA1c, glycated hemoglobin, oral glucose tolerance test, OGTT. Fasting blood sugar measures the level of glucose in your blood after not eating or drinking anything, except water, for at least 8 hours. It is usually done in the morning before breakfast to get an accurate baseline. This test helps in detecting diabetes or monitoring blood sugar control in patients. Normal values of FBS. Normal range, 70 to 99 milligrams per deciliter, 3.9 to 5.5 millimole per liter. Pre-diabetes, impaired fasting glucose, 100 to 125 milligrams per deciliter, 5.6 to 6.9 millimole per liter. Diabetes is greater than or equal to 126 milligrams per deciliter, 7.0 millimole per liter, on two separate tests. HbA1c, glycated hemoglobin. It is a single test, measures average blood sugar over the past 2 to 3 months. Not require fasting. Diagnose diabetes and monitor long-term control. Results: normal, less than 5.7%. Pre-diabetes, 5.7 to 6.4%. Diabetes is greater than or equal to 6.5%. Good diabetic control for diagnosed patients usually aim for less than 7%.
The oral glucose tolerance test, or OGTT, is a test that measures how well your body processes glucose. It is commonly used to check for diabetes, prediabetes, and, during pregnancy, gestational diabetes. The procedure begins with fasting. You need to fast overnight for 8 to 10 hours before the test. On arrival, a fasting blood sample is taken to measure your blood sugar level. Next, you are given a measured glucose solution to drink. For most adults, this is 75 grams of glucose dissolved in 250 to 300 milliliters of water. In pregnancy screening, different amounts may be used, sometimes 50 or 100 grams of glucose, dissolved in slightly more water. After drinking the solution, blood samples are taken at set intervals, usually 2 hours after the drink. In some cases, blood may also be tested at 1 hour and next 2 hours after drinking glucose. These samples help the doctor see how your body handles the glucose over time.
When it comes to treating diabetes, the approach depends on the type. For type 1 diabetes, the body cannot produce insulin, so patients require regular insulin injections to manage their blood sugar. In type 2 diabetes, treatment often starts with lifestyle changes like a healthy diet and regular exercise. Oral medications, such as metformin, may be prescribed, and in some cases, insulin might also be needed. For gestational diabetes, which occurs during pregnancy, management focuses on diet control, but if blood sugar remains high, insulin may be necessary. Proper treatment helps prevent complications and keeps blood sugar under control.
Nursing care plan. As a nurse caring for a patient with diabetes, monitor blood glucose regularly. Educate the patient on insulin use and self-monitoring. Promote a balanced diabetic diet. Encourage regular physical activity. Monitor for complications like neuropathy or foot ulcers. Provide emotional support and motivation. Thank you for watching this video. If you learned and upgraded your knowledge, don't forget to like, subscribe, and share this video with your friends. See you in the next lesson.